Hello, my name is Brittany Seal and I'm reviewing the case about Adeline. So my patient Adeline is a 42-year-old female. She's come in with a chief complaint of heavy, painful menstrual bleeding. The patient states she's been experiencing heavy and painful menstrual bleeding and breakthrough bleeding in between her menses for the past 3 months. She states she's been having a heavy bleeding episode again today, so she wanted to come and get checked out. Her past medical history includes a urinary tract infection, abnormal pap smear, and 2 spontaneous vaginal deliveries. She has a surgical history of a colpo, no known allergies, just her family history is diabetes and her maternal grandfather. For her social history, she reports that she has never smoked, uses alcohol occasionally, 1 to 2 beverages a week, and denies use of any illicit drugs. So for my subjective data, Adeline is an established patient who presents today with heavy and painful menstrual bleeding and breakthrough bleeding for the past 3 months. The patient reports that her pain is rated a 6 out of 10 on the pain scale. She reports a constant cramping pain that worsens with activity. She denies pain during intercourse. The patient states that she is voiding and stooling daily as normal, and she is reporting intermittent nausea with the pain, but no episodes of emesis. The patient states that she is not on any contraception because her husband has had a vasectomy in the past. So for my objective data for Adeline, she is 5'3", her weight is 180, her BMI is 31.9. Her blood pressure was 115/72, pulse was 69, respiratory was 18, temp was 97, and pulse ox was 100. So generally she was overall well appearing. She is obese, alert oriented to her person, place, and time. She's normal cephalic, normal heart rate and rhythm, no murmur noted, normal rate and rhythm, no use of accessory muscles, and no respiratory distress noted. Her abdomen is soft. She has abdominal tenderness, no CVA tenderness. Her skin's warm, dry, and intact. Breasts are normal, symmetrical, bilaterally, no lumps or masses noted. And for genitourinary, she has a normal appearance of her external genitalia. There's dark red-brown blood observed in her vaginal bolt. Her cervix appears normal. There's no abnormal discharge or foul smells noted. The uterus is smooth and mobile. She does have tenderness present during her pelvic exam, and no cysts or other masses were palpated during the manual pelvic exam. So my assessment is that this patient appears well appearing with a heavy menstrual bleeding, abdominal and pelvic tenderness. Patient appears stable, but is losing her quality of life due to these factors and this pain. For the plan for her abnormal uterine bleeding, a pregnancy test should be collected, a CBC, CMP, and coags just to check her platelets, her hemoglobin, hemocrit, and clotting factors. She should have her TSH and T3 and T4 checked, her FSH, her LH, her prolactin, and estrogen levels. And then she should also have a transvaginal ultrasound, and an endometrial biopsy should be collected. For her diagnosis, she's been diagnosed after all of this with an endometrial polyp. These are local benign hyperplastic growths that attach to the uterus. So the plan for her, the most common complaint of endometrial polyps is the heavy bleeding and the irregular bleeding. So to treat this, the patient needs hormone regulation, especially with her estrogen. So this can be done with an oral contraceptive, the Depo shot, or a progestin IUD. Over-the-counter pain relief can be done with ibuprofen or acetaminophen, and a heating pad is another way that can treat her abdominal cramping. The patient will be initiated on an oral contraceptive and be educated to wait and monitor for bleeding and pain improvements over the next 3 to 6 months. If this pain or bleeding worsens, the patient may be referred to a surgeon for surgical removal of these polyps. Follow up in 6 months or if the condition worsens. Thank you.